On this episode...
You're a real city boy, you can't come onto a farm like this.
Okay, I'm going in. So, oh man. It's absolutely amazing to be able to use an ultrasound like this in the field. Farm stuff's hard work.
Today I'm off to Wales for something completely different and I really need to get on the road. The idea first came up when a client of mine mentioned that they had a relative that runs a big rural practice in the beautiful green rolling hills of Wales. Now I have always had a bit of a daydream that one day I'd pack up the family and head to a completely different environment, somewhere with clean air and wide open spaces, and become a country vet. I'll be the first to admit that I'm going to be completely out of my comfort zone, and I'm pretty nervous. It's been a very long time, pretty much since my university days, since I've seen the business end of a cow or a horse. So it'll be very interesting to see if I can convince the locals that this city slicker's got what it takes.
To you?
Yeah.
Hello there, ladies. How you doing?
Good, how are you?
Good. I was actually trying to work out how to say hello in Welsh. How do you say it?
Hello.
Oh, so you just say it with a Welsh accent?
Yeah,
Good to know.
keeping it simple.
Yeah, well, you definitely need to do that for me. I'm supposed to be seeing the boss. Whereabouts is he?
Right through there.
Wish me luck.
Good luck.
Hi there, David. So pleased to meet you.
And
welcome.
you.
Yeah, welcome to beautiful Wales.
Look, I'm so excited to be here. I can't wait to get started.
But gee, look how you're dressed. You're a real city boy, you can't come onto a farm like this. We're going to do real work, we're going to see real animals today, Scott.
Okay, all right, I'm intimidated already. All right, what have you got for me?
We've got a busy day on farm, so I need to get you some proper gear.
Not my usual kit, I'll be honest, but look, I'm happy to get stuck in with the farm work.
Right, let's get you kitted up and then we'll crack on.
Sounds good.
Good.
Forget any notion of lazing around watching the grass grow in sleepy old Wales. We're into it straight away.
Good girl. Off you go. This should be 51 days.
There are 3 generations here, my grandmother and then my mother and aunt and I. Everybody has an opinion, but as long as we get there in the end, that's the important bit.
Hello there, ladies.
I'm Virginia.
Hi, Virginia.
I'm Olga.
Olga, hello.
Hi, Stephanie.
Hi, Stephanie.
Isabel.
Isabel. I'm feeling a little bit of intimidation with you four already. Do you normally feel like that when you come here, David?
I've got used to it over the years.
You got used to the girls.
I'm acclimatised.
Right. So what have you got me here for today?
We've got a pedigree bull, so we need you now to have a look at him to make sure that he's fit for breeding.
Right. Well, I'm so glad.
Are you up to the challenge?
Well, I'm not sure if I am really. I've not seen a big hulking bull in quite a while, so I don't really know what I'm looking for. What will I be looking for?
Yeah, we'll be checking his testicles.
Right.
Most importantly.
Excellent. Yeah. No, that's brilliant. With this for watching on, I'm sure I'm going to go just fine. All right. Well, shall we unleash the beast?
Let's go. If he's used to smaller animals, seeing a bull is going to be totally different.
I'm very worried about seeing this bull. I'm sure he's an absolute giant.
Bulls can be a bit aggressive, they can be dangerous, so I think we've got to be careful in this situation.
Oh, great. It's tiny.
The bull, there he is.
I was expecting something this high.
You'll grow into a big bull eventually.
He's only a baby.
Let's go down, let's have a look at him, Scott.
Hello, boys.
If you look carefully, you'll see he's got a tremendous hindquarters. He's really well built. And so that's why they feel he has potential as a bull.
So what you're saying is that he's got a bigger bum than the other one. And from a beef cattle perspective, he's going to pass it on to any offspring that he has, which is also
That's right,
very
yes,
positive.
and produce very good beef calves as well.
Dave and I commenced the examination of this bull from head to toe to make sure he's up to scratch and he's going to be a good dad to all of the Roberts family's new calves.
It's got a lovely temperament.
Yeah, I can tell. Yeah, he's
Good boy. He's just very strong. He's a very strong animal. But otherwise, he's lovely and quiet. You can handle him quite nicely. We'll just check his teeth, see what his teeth look like in his mouth.
Yeah.
Good alignment of the teeth with the upper jaw. Would you like to have a turn and examine him? Have a look at him?
Yeah, sure. This bull is maybe not as big as I expected, but it's certainly bigger than all the patients that I treat in Richmond. Good boy. Are they like dogs and cats? Do they respond to being talked to?
Yes.
Yes.
Yeah, definitely.
Yes, they do.
Definitely.
Oh, well, there you go.
They know your voice.
Oh, hello. You probably haven't heard my accent before around these parts, I wouldn't have thought. Hey, g'day mate, how's it going? Hey? Hey, you're a handsome fellow. Nice, incredible. Incredible to look at these beautiful brown eyes close up. Very nice.
Right, let's check his heart.
Yeah. Good boy. Good boy. My initial impression is that it's running faster than I thought it was going to be.
But just same with dogs and cats, the younger they are, the faster the heartbeat.
Yeah. His eyes seem good, his heart seems good, everything else is looking very, very good. But at some point, I know I'm going to have to go to the business end. All right, Merlin, I promise to be gentle.
If the bull hasn't got good testicles, then you won't be able to work as a breeding bull. Getting nice and close to him. Okay, grab both testicles. Get a nice firm grip there, Scott. Well, Scott's definitely got his hands full, but he's got great technique.
Feeling good? They're very firm. They're very impressive. Yeah, I feel myself blushing. It's a nightmare.
Merlin the bull likes his scratches and he likes to be with people. Obviously, they're bonding.
Good, just check them for symmetry and size. Check for any lumps and bumps. And they're of a good size for his age. Everything feels great.
They do feel great. Ladies, I think that your bull, hopefully, he's got the equipment suitable. He's ready to go. I think the Roberts family are going to be very happy to know that their bull's up to the job. I'm just not quite sure that I am. Okay, big guy. There you go. Good boys. Farm stuff's hard work. It's been such a long time since I've been at a dairy farm. It's been 17 years, so a long time, and I'm actually really looking forward to it. All right.
Ready to crack on?
Yeah, absolutely. David obviously is the lead vet here. He's the man that knows what he's doing, and I'm the humble pupil.
Yeah, I've got one for you as well, Scott. We'll get the scanner out for you now on the front there. Just put this on, put the headset piece on.
Wow. Quite a bit of kit, isn't it?
Yeah, we're all spaced out now.
Yeah. It's a very interesting kit. It looks straight out of Star Trek. It's basically just an ultrasound. The same thing that we would use in our clinics back in Richmond, but this is designed for internal use. And I'm not very much looking forward to where I'm going to have to put it.
Have you got an image?
Oh, wow, yeah. Cool. Yeah,
Good.
so that's the ultrasound scanned image I can see right in front of me.
That's right, yes. Okay,
right.
let's go.
I'm actually feeling surprisingly nervous, way more nervous than I ever expected that I would. I'm an experienced vet, but not experienced when it comes to large animals. So I feel like I'm almost going back to school. Morning, girls. How you doing? I just hope I'm up to the challenge. All right, so here's the first lot of patients for the day. Here you go, good girl. Hello, ladies. I promise to be gentle. It's really important that every cow on the farm gets pregnant every year. If they produce a calf, then afterwards they can produce milk. It's just like when you're a mum, you only produce breast milk once you've had a baby, and the same applies in cows.
I'm just going to scan the first few cows.
Yep.
And if you just watch to see what I'm doing, and then later on you can have a turn, have a go, right?
All right.
So we're going to use the scanner to see if they're in calf. Just put that.
Most of the time these girls have a lovely time eating grass in the beautiful Welsh fields, and the farmers of course keep very close tabs on them, but every now and again they do have to get them in and do medical procedures on them. It has to be done, but hopefully we'll be as gentle and as kind as possible.
Again. So mark with chalk. Block a blue when she's in calf. So you know, all pregnant, all the blue cows are in calf.
I've got a nice blue tail.
That's right, nice blue mark on the back.
Okay, next.
So you got to watch them because they will barge on.
Okay. I'm like a cow bouncer.
That's right. You're doing a great job there.
Thank you very much.
I know that Scotch will find it a challenge. And just putting his arm into the cow, it's a whole foreign environment. And I think he's really got his work cut out today. I've scanned it, I've checked her. So we'll now give you a go and see what you can find in the cow.
Okay.
So, you all ready?
Yes.
Is the scanner turned on?
It's definitely on, so at least the equipment's right. I can't blame the equipment.
Okay, good. Let's see how it goes.
It's been such a long time that I've worked with cows, and so I really want to make sure that I don't embarrass myself too much. I'm totally put off by the sound effect she's giving me there. That's pretty impressive.
Go on, get on with it, and we'll see what you find.
Okay, I'm going in. So, oh man. That's an experience I haven't had in 17 years. That is, oh man.
I'll be quite happy if Scott can just find the womb initially.
Is it in the top left-hand corner of the screen? Would it be there?
If he finds a pregnancy, I'll be really pleased.
What can I see here? Okay, I'm trying to find her uterus.
Just scan left and right, move the probe over the womb, just left and right.
It's absolutely amazing to be able to use an ultrasound like this in the field. Oh, wait a minute. What's that?
I can tell from Scott's expression how he's getting on. And initially I can see he's really concentrating, he's focusing on what he's doing. And then eventually you can see his eyes light up.
Oh, there we go.
And you think, wow, that's the eureka moment. He's seen something wonderful, great, fantastic.
Okay, teacher, please tell me, I'm pretty sure this girl's in calf.
Yes, she is in calf. Well done, Scott.
Oh, thank God.
She's in calf, she can go. And then, of course, you have to move on to the next cow, and the next, and the next, and you have to do it all over again. But so far, he's doing great. We'll make a farm bet of you yet, Scott. Welcome to Wales.
Oh, mate. This is an incredible experience. It's so out of my comfort zone, but also really exciting and interesting and different.
I've just got poo on my lens. I've had a poo accident.
That's nasty. And I'm covered in poo. How can I wipe that off? Philip mentions about the fact that there's a foal hernia. Now, I haven't done horse surgery since university, so I'm incredibly nervous. I hope I can help, and I hope that Philip has faith in me. Hello.
We're going to send you up the paddock, pick up the foal, and Kim and I are going to start setting up in the barn.
Okay, I'll get the foal, you get prepped.
That's right.
Sounds good. All right, see you in a bit.
Right on, okay now. Normally I do these things on my own, so it'll be quite novel to have an extra pair of hands there.
You don't know what you're in for, do you? That's my coat you got hold of. Don't pull me over. Don't pull me off. He's naughty. Let go. You haven't brought him up with very good manners, have you? You have him, Misty. I spent a whole lifetime with horses. I don't think I would want to live without the horses. They mean everything to us.
Hi there, Di. How are you?
I'm very well,
Lovely
thank you.
to meet
Getting
you.
a bit wet, but there we are.
A little bit wet, a little bit windy, but there we are. We're in Wales
We can't
in a
help
field.
it, can we?
Very brave boy. You going to be a brave chap? Hey? Yeah, you can see so clearly that hernia. It's a decent sized one, isn't it?
It's nasty, isn't it?
An umbilical hernia is basically a hole in the abdominal wall where the muscles haven't closed after birth. And what happens in Freddie's case is that the abdominal contents will leak out through the hole and lead to a bulge under the skin. I promise I'll look after your boy. I will.
We've all made that promise to her, haven't we, girl?
Okay. Come on, Freddie. It's all about you, mate. The real danger in Freddie's case is that his intestines can pop through that hole and then their blood supply is affected, and literally Di can walk out into the field one morning and find Freddie dead. So it's crucial that we perform this surgery today.
Good, Misty. Good boy, Freddie. Good lad.
Misty's there, so it's comfort for him. Once he's under anaesthetic, he won't know what's going on. But all the time Mum's there. If you take Misty out, well, then he can get upset.
Come on, Freddie. Good boy.
Well, any operation is a risk, isn't it? They're like children to us. You know what can happen or can't happen. You hope for the best, obviously, but there's always that element of doubt.
Okay, I think we've got everything else here, so yeah, basically we're good to go.
Come on, Freddie. Guys, I've got your patient.
I walk around the corner into the barn and it's a little rustic. I can't see any shiny lights. I can't see any steel. It is a shed full of hay and we need to do surgery in it. Different.
So, Philip, I was going to have a quick feel before
That's
we
right,
knock.
yeah, because it's quite nice to know now exactly what we're dealing with and how big the actual opening into the abdomen is.
So I can get 2 fingers into
Right.
the hole.
Okay.
Definitely bigger than the hernias that we feel on little dogs and cats back in
Oh
the
yes,
chin.
I'm sure. Yeah, that's right. Scott can extrapolate what we're doing back to his own animals in his own surgery in London, and the actual techniques are the same. It's just the scale that changes.
Wow. It's like a javelin.
Bigger than what you're used to.
It goes back here.
Yeah. Good boy. Just hope I get it in the right place.
No need for that.
Oh, that's sweetheart.
Trying to place an IV catheter into a horse, a massive different world.
Where's your blood vessel gone, mate?
We did our absolute best to get it in as calmly and as safely as possible. But this is a young horse, and horses can sometimes react erratically, and vets can get injured as a result.
Good boy, I know.
Yeah, that's in. Good job.
Phew. Gosh, and that's the easy bit. Yeah. That was actually really difficult. I haven't catheterized a horse since uni, which is quite a while ago.
Stick to rabbits.
Yeah, stick to rabbits, fair enough.
Freddie's being such a beautiful patient, such a good boy the whole way through. But obviously the time comes when we need to give him the drugs to knock him out and perform the surgery.
Right, so I'm just going to inject the ketamine into his vein.
Okay, we'll see you on the other side. Hmm?
So it's really important that we're in a safe place. They're so heavy and if they go down in the wrong way, they can catch you out, and you just need to have your wits about you, really.
Okay. Good lad.
Come to you, Scott.
Yeah. Oh, that's a good ball. Oh, what a good boy. You're right there, mate.
Stuck in the straw. Right.
Once the laughs are over, once Philip's managed to regain his footing, we have to crack on with the surgery.
So next stage now, we'll roll him onto his back. Roll him up. Okay. We'll just crack on and get ourselves scrubbed up and ready to go.
I've done countless umbilical hernia repairs in dogs and cats. That's bread and butter for me, but this is on a bigger scale completely, with an animal that can kick me in the head, and then I'm being watched by Philip. Quite intimidated right now.
You'll be fine. You will. Nervous now, very nervous. I'll be glad when it's all over. He's up and with his mum.
Right, now, so I'm going to click my initial incision up here. So we should be far enough away from anything dangerous. Surgically, the main risk is that we could damage the intestines as we're going in. And also when we're putting the sutures in place, there's always the risk that we could actually accidentally catch part of the intestines, and that can cause quite serious problems. Well, there we are. So we've got bowel there straight away.
That was just millimetres underneath that sac.
That's right, so we didn't want to damage that at all.
Well, that could lead to all sorts of complications like peritonitis and even death if you
So
nick that.
Yes, we nick that. It's just like having a burst appendix, really.
If you nick in the intestine, then the horse can get a massive infection called peritonitis and they can die from it. It's exceptionally painful. It's an absolute nightmare. So it just shows that this procedure is actually a very serious one indeed.
And now that we're in there, the actual hole is a lot bigger than what we could feel on the outside.
That's amazing that intestine pops out so easily like that.
Yeah.
Wow, it just shows how important this surgery is.
Oh yeah, yeah. Basically a strangled hernia is where some bowel comes out and the blood supply to it is cut off. Then the animal can be brought in and then an emergency op if you're lucky, or a dead horse in the field if you're not lucky. Right, I'm happy with that now. Okay. So I think we need a third, so if you'd like to do that.
Yep. Okay. Got you in the finger.
That is my finger, yeah.
Oh,
I'm aware of that.
That would have been instant dismissal.
Oh, this is a treat for me. I don't usually have another pair of hands in here on this job.
Happy to help.
Yeah. That's lovely. Okay, good man. I think Scott is doing very well. Although he hasn't handled horses or large animals since he left college, he's got his good surgical skills. That's it, it's gone.
Nice, neat tummy, all tight for show jumping.
That's right. Okay, Scott, take the leg.
Yep.
That's it.
Good boy, Freddie. Good lad. This can be a really dangerous time for horses because they can react erratically, they're very strong, and so he can go from being an animal that's just been fixed to an animal that's very easily broken. Come on. Mummy's just over there. Good boy.
It's almost over now, so hopefully he'll get up and be a bit wobbly, but then Mum can look after him. Everything will be all right. That's fingers crossed.
There we go. Up you get. Come on, buddy. You can do it.
There we are. Lovely.
Good boy.
Freddie takes such a long time to wake up, but slowly he comes right.
Look at him struggling towards Mum.
Yeah, I think he wants a feed, doesn't he?
He wants a feed.
He wants solace.
And that's an absolutely glorious moment. It's a real relief to see him up and then suckling from his mum. Absolutely beautiful.
He's gone to the milk bar.
That's right.
So, Di, that was quite intense. I must say, I was probably
But it's over now.
as nervous, though, as... Well, I think I possibly was more nervous than you.
Oh, I don't know. I wouldn't say that. Scott has done brilliant. And he's been nice with him, and that means a lot.
Good boy, Freddie.
I must admit, I've absolutely loved it today. Di's an incredible woman. We're in a nice warm shed performing an incredible surgery on a beautiful animal with a great result. And my relief, I think, was just as much as Di's.
Hopefully that's expressing his happiness at our work. Not bad, City Slicker. Good job. Hey, Joe.
Hiya.
What's happening?
This is Toots I chatted to you about. So we've just done the x-ray. Bladder's full of stones. Yeah, poor little man.
So just like 1 or 2 stones?
No, literally looks like sort of 30 in there, I think. So the more help, the better to get them all out, I think.
No worries. Okay, well, I'll go and defarm and I'll be back in a sec. See you in a bit.
Lovely. I can feel he's a bit tender still when I feel on his bladder, so definitely that's still the area that he's sore in.
Yes.
I think what we need to do now is just take it to the next sort of stage of diagnostics, so to try and work out what's going on. And the best thing for that is going to be to do an x-ray.
Okay.
And go from there then, all right?
All right. You're going to behave yourself, are you?
There we are.
See you later, baby.
Brilliant. Good boy.
There's a good boy.
We've had Toots in with us today. He's a 9-year-old Bichon Frise who we've seen for recurrent urine infections. Come on then, there's a good boy. Come on, little man. Hi, Lauren. This is little Toots.
Hi, handsome.
Today we've taken an X-ray and we've seen that his bladder's full of bladder stones. Oh my goodness.
Oh, wow.
I think we can see what the problem is. So the aim really is to remove all stones or as many of them as we can. So what we're hoping to do is just go in, assess the bladder, remove the stones and flush out any of the smaller ones. I think we're ready to start.
Right, finally I'm in a uniform that I feel a bit more regular in. This is my normal job.
It's going to be quite nice having an assistant, I think.
All right, let's get those nasty stones out, shall we?
Expecting the bladder wall to be quite thickened as well if he's had the stones in there for a little while. You can just see his bladder there.
Yep.
I can feel a stone just under my finger actually.
No
just
way.
there.
Can I have a feel? Oh, wow. It is like a bag of gravel. Yeah.
Poor little boy.
Yeah.
There's the bladder.
It's very angry and inflamed, isn't it?
Yeah.
It is certainly a very irritated bladder, and it's because of the stones within.
And how big were these stones looking?
They weren't looking very big, but there's quite a lot of them. So I think if we start with a small spoon, and then if we need to, we might need to get the bigger one in just to see if there's any bigger bits in.
Normally, when you remove a bladder stone, it's a nice, round, smooth rock, really. It's like a pebble.
There we are.
Wow.
These ones, however, are very harsh, they're very sharp, and they're deeply embedded into Toots's bladder wall.
Nasty little suckers, aren't they?
It feels like there's quite a few more in there as well, I think. They felt like they were a bit deeper down.
Wow.
Goodness me.
Look at that.
Looks like a little hedgehog, doesn't it?
It does. There you go. Didn't know they lived in bladders. Oh, you're gonna feel better with those out, mate.
Yeah.
The more we scoop, the more we find. It's incredible. They just keep coming and coming, and they're really angry, sharp-looking stones that are getting stuck into the bladder wall and really causing irritation to poor Toots.
And I think it feels like there's quite a few more in there.
Poor boy, he must have been in some discomfort with those.
You can see why it's inflamed all the bladder wall so much, can't you?
As a boy, passing those types of nasty stones, ouch.
Oh, there's a whopper.
We were expecting quite a few stones, but there's more here even than I thought there might be. They seem to be never ending. 27, and I think that's 28.
28.
Yeah, goodness me. And some of these look like sort of, 5 or 6 joined together to make a big one.
That's a lot of bladder stones.
And still a few more in there, I think.
Right, so do you feel confident then that that's the last one?
Yeah, I think that's it. 2 more from that last flush, so that brings us up to 30.
Look how chuffed you are getting that right on the X-ray. Very impressive.
We removed all of the larger stones, and I think it's the biggest haul I've had from a bladder so far.
All right, let's close this boy up.
Lovely job. It's going to be a bit of a recovery because there's obviously so much swelling and inflammation on the bladder wall. It's going to take a little while for that to settle down, but you should make a full recovery. Thank you very much for your help.
Oh, more than happy to do so.
Being involved in this surgery, you might think, oh wow, it's opening up a bladder of a dog and pulling out stones. Well, for me, it was a relief. It was great to be in 4 walls and a roof, not covered in rain, not covered in poo, and doing something that I know how to do really well.
What do you think I've got for me next?
5:15, it could be anything, so I'm sure they'll have something in store. As long as you've got your wellies on, I'm sure it'll be covered.
I just had a phone call from one of the young farm vets, Vicky, and she needs my help. I have no idea what kind of animal I'm dealing with, but I'm looking forward to seeing what she's got in store. Right, Vicky, the cavalry's here.
Oh, it's got muscles.
Right.
Hope you've had your Weetabix this morning.
Okay, why?
Oh, we've got quite a big ram to deal with today.
Oh, a ram?
Yeah.
Really?
Hello there. You're a funny-looking ram, aren't you? Hello. Mwah. You're handsome. Hi there, Val. I'm
Hi.
Scott.
Hi, Scott.
How you doing?
Nice to meet you.
Nice to meet you as well.
It's pretty much like Noah's Ark. There's animals everywhere. There's donkeys, there's a mule, there's little ponies, there's even a alpaca. It's amazing.
We take in animals that have been abused or neglected, and this is their forever home. People contact us when they know that there's an animal in need, because they know we'll go and get it. We just love what we do. When he came, he was just called Rami. I didn't like the name, so I put a thing out on my Facebook page and asked for ideas, and somebody suggested Gordon. Gordon Rami it was. I went out to the field today to check on them, and I saw he was bleeding from his horn. He obviously needs help from you guys.
So how are we going to go about catching this chap?
I think that's your job, really. Into this corner, just muscles.
Right. Right, wow, so it's very technical.
Just muscles, that's all we need today.
Okay.
I'm going to enjoy watching this, because I did it earlier. Gordon is very feisty. When I was treating him earlier, it was like buckaroo around the pen.
Okay, well, should we just get stuck into or just vault this?
I would open the gate.
Right.
It's much easier.
Sure, okay. Fair enough.
Okay.
Here we go. There we go. That was easier, yes.
I should have not said anything and just let him fall over, but I thought it was common sense. Why climb it when you can walk through it?
Hello, Gordon. Keep that infamous temper in check.
Yeah. Good luck, guys. You're going to need it.
Okay. Come on. Whoa. Oh, my goodness. Yeah. Come on, champ. This way. Oh, man. Come on. Come on. Good boy. Okay, good boy. Oh, you.
Who's winning here?
Well, it's sort of a tie at the moment.
Good.
Wow, that looks disgusting.
Yeah. I'm really close to his head. You can see there's a lot of discharge, there's maggots present. Alongside that, it really smells.
Whoa.
Wow, that goes down quite deep there.
Gosh. That is unbelievable.
Yeah, it's probably going down in towards his sinuses.
Yeah.
Fortunately, Val's found this quite soon, so it hasn't done too much damage.
It's all right, mate. Good lad. Good boy.
Right, I think we're give us a bit of a clean up and then give him some pain relief and some antibiotics. Hey man, make you feel a bit better.
I was very, very concerned and very, very anxious whilst he was being treated.
Ooh, ooh, no. No.
I'd be devastated if I lost him, because he does, literally, he means the world to me.
What do you think of those fine ingredients, Gordon Rami? Is it going to sort you out? I reckon. Here we go. All right, be brave, mate.
And we want to try and dry up all the infection that's there, get that growth to shrink back and then try and seal off those holes so nothing can go back down into there.
It's all right, mate. Good boy, brave boy.
Scott really does have a great affinity with animals, and I've never seen that with Gordon, especially with somebody he hasn't met before.
Oh,
sorry boy. As you can
little
tell.
shower there.
That connects down into his nose on this side.
Certainly does.
So,
got a nice snot shower there.
Yeah. Nice and spray. This is just some antibiotic spray to help with any infection. And then
hopefully this will colour.
Nice silver.
Oof.
Helps with healing.
Looks great.
Yeah.
So antibiotic injection and then pain relief.
Yeah. Are you ready? Both of you?
I think so.
This one is in...
Take it like a man.
Yeah.
Come on. Good boy.
There we are.
Good boy. Brave boy.
There we are.
How'd you go? Well done.
Good man.
Good boy.
That should make him feel a lot better. I was a bit dubious when I rang Scott as to whether his muscle factor would be advantageous for me.
Hopefully in about an hour or two, mate, you're going to feel much better.
But I think his allure to the animals was probably more than the muscles, to be honest. And I think his sweet whisperings in Gordon's ear helped.
Hopefully those drugs will start kicking in, you'll feel better. Back to your feisty self, eh?
It was really great to be involved. It was great to see Vicky at work.
Good boy, Gordo. Good lad.
And great to meet the wonderful Val. What an amazing woman.
Ah, he was a perfect gentleman in the end, wasn't he? Just like Gordon Ramsay, obsessed with food.
I'm back to pick Toots up after his operation. So, big smile on the face today.
Oh, are you feeling better? Hey? Are you feeling better? Oh, good boy. Should we go and see your mum? Hey, who's this then? Ah, who's this? Pleased to see you, I think. Little man. Oh, good boy.
You don't know how happy I am. No, it's a really good feeling. I can't stop smiling now that I've got him back.
You heavy little monkey.
I know, I think he's put on weight. He's done so well. He's really bright this morning. He's really happy. Doesn't seem uncomfortable at all. So,
You're not going to talk to me, are you?
No.
It's all over and done with. Just want to get him home now and cuddles on the sofa tonight, and that's it.
Come on, there's a good boy. Going home now, aren't you? Yes, you are. Come on, dear sweetheart. Come on.
I've absolutely loved every minute of my time here in rural Wales.
He's got a lovely temperament.
Yeah, I can tell. That's an experience I haven't had in 17 years.
We'll make a farm vet of you yet, Scott.
The farm vets and nurses have just been so inspiring to work with. The animals, impressive and beautiful.
I think I possibly was more nervous than you.
Oh, I don't know. I wouldn't say that.
Hello.
But I think it's been the wonderfully warm and resilient Welsh people and the fantastically beautiful landscapes that have captured my heart and made me think that I could make a go of it as a farm animal vet. But for now, I've got to get back to my family, back to the practices in Richmond, but I know I'll definitely be back.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.